Lodge everybody and welcome to the Nursing Recognition virtual presentation. First time we've ever done it. So good morning and welcome to Bendigo Health's Nursing and Midwifery Awards ceremony for 2021, including our special guests, board members, individuals and delegates and groups who generously provide awards. Unfortunately, due to a prior commitment, our CEO Peter Faulkner is unable to attend today. However, he's asked me to convey his apologies. I would like to take this opportunity to acknowledge that we are meeting on Jaja Wurrung country and pay my respects to the Jara people who are the traditional custodians of our lands, which we meet upon today. We would also like to pay my respects to elders, both past, present and emerging. Today is a special day. It is the International Nurses Day and a celebration of nurses and midwives, particularly acknowledging the significant contribution they make to providing excellent care for our patients. It is also an opportunity for recognising nurses and midwives for their achievements. I am now pleased to invite Marilyn, Bendigo Health Board Member, to deliver the opening address. Welcome, Marilyn.
Thanks, David, and happy International Nurses and Midwives Day. What a great day. And it's wonderful to have this recognition every year, but last year was the International Year of Nurses and Midwives, and look where we went. Anyway, I'll come back to that. I'd also like to join David in acknowledging the traditional owners. I'm a nurse. I'm very proud to be a nurse. And the last year has really seen me reflect upon the 50 years of my work as a nurse and think about what are the pivotal points in my long career that have had continuing meaning. And given that we were in a year of pandemic, I reflected on a whole range of things that began for me. The first example that I'm going to reflect on, as a student nurse of 17 in an apprenticeship style hospital-based training, 17 years old, night duty in a neurosurgical ward, and I thought it would be pretty funny to paint a face on the backside of an unconscious woman in Metaphen that could not be removed. Even thinking about it now brings me pain. I was called the next day, coming into shift, into the charge nurse's office, and she said to me, "Did you do that?" I was absolutely mortified. She said, "Would you want yourself or a loved one to be treated like that?" And I was appalled with my own behaviour. I have never forgotten it. I know the woman's name, I know the charge nurse's name, and I know what the lesson is. Don't ever treat any of those in your care in any way that you will not want yourself or a loved one to be treated. And that's what I've carried through 50 years of work. The second example, once again a graduate nurse doing my psychiatric training in a hospital in the country, huge asylum, all of the town worked there, generations worked there, or the prison, and I was an outsider. One morning on our 12-hour shift, a student nurse from the general hospital was working beside me and we could hear someone screaming. 6 a.m, freezing cold. I don't know if you know inland New South Wales, it can be freezing. The screaming was coming from a cage between two wards upstairs. We were in one ward and the charge nurse that I went to see in my ward said to me, "Oh, it's not our patient, don't worry about it." The screaming went on. I was worried about it. I went to the charge nurse and I said, "I am worried about it." She said, "Go back to work." I didn't. I went beyond. They said go back to work. I went beyond. They said go back to work. I was terrified, absolutely terrified. And the whole thing ended up with everybody saying that charge nurse in that ward always does that as punishment for bad behaviour. Now, for me, that was wrong. Would it happen today? I don't think so. But that was a huge lesson for me to speak truth to power. I went through the rest of my student days in that institution with the majority of the staff not speaking to me. Ultimately, I became National Secretary of the Nurses Federation. When it got to the days of deinstitutionalisation of psych hospitals into the community, I was very well able to face them. Once again, speak truth to power. The third example, and I was reminded of this last year when I was run by a young nurse doing her thesis on HIV and nurses, a nurse's role in the HIV pandemic. And she reminded me of the way in which nurses mobilised to counteract the discrimination that was being exercised by their colleagues in hospitals by saying, I'm not going to treat anyone that's positive for HIV. I'm not going to do surgery on anybody that's positive for HIV. Nurses had to lead the installation of universal precautions into every single health setting across Australia and ultimately the world. So nursing leadership comes through that courage of what's best for everybody here that I saw displayed so well in the pandemic. And the way that Bendigo Health staff, in particular on this day that's recognised the nurses' role in leadership, in making sure that we were in front of the pandemic. Whether or not we had permission, waiting for instruction, knowing when we had to take action. Across our own services, across aged care into the private sector, into the community, providing leadership, being part of your community. It was wonderful to watch. So I'm very proud to be part of the Bendigo Health family, and particularly as a nurse, and particularly on this day, and to recognise the wonderful work that you do. So thank you for the great work that you do, and thank you for asking me to speak today. I do love being part of this amazing profession that takes us into the most extraordinary places across the world, but for now, Bendigo. Thank you.
Thank you, Marilyn. Inspiring. So today, as we know, it's International Nurses Day, celebrated on the 12th of May every year. And the theme for the 2021 is Nurses, a Voice to Lead, a vision for the future healthcare. 2021 will focus on the changes and innovations in nursing and how this will ultimately shape the future of healthcare. The global pandemic has highlighted the important role that nurses and midwives play in keeping our community healthy and safe across every healthcare setting. Our profession has played a vital role in responding to challenges, conditions, and we thank everybody for their professionalism and tireless work over an extended period. At the end of today, we do have a wonderful video that our comms and marketing have put together that we'll show at the end that really celebrates the growth of nursing and midwifery through our organisation. So let's get on with some awards and celebrations. So our year hasn't only been defined by COVID-19. Many of our nurses and midwives took the opportunity to commence or complete further studies to enhance their skills and expertise. We are incredibly proud of the breadth and quality of traditional programs offered to support nurses and midwives making the transition from undergraduate students to qualified health professionals. These beginning practitioners are provided with extensive clinical support and ongoing education to enable continued development of clinical and professional competencies. Afforded such opportunities, Our graduate nurses and midwives are able to provide safe, quality care and continue their careers as valued staff members of Bendigo Health. Congratulations to all our nurses and midwives who have completed their graduate year in 2020. I would now invite Jodie White, our Senior Nurse Educator, to provide an overview of the accredited course programs supported by Bendigo Health. Welcome, Jodie.
Thanks very much, David. Bendigo Health is committed to encouraging all our nurses and midwives to pursue further education by offering a number of accredited courses. Our objective is to provide on-site opportunity, reduce financial burden and encourage continuation to higher qualifications. New courses offered by Bendigo Health in 2020 included the Skills and Theory Expansion in Practice, or STEP programs. These programs were specifically designed to meet the professional development and learning needs of nurses within the acute and subacute inpatient units. Congratulations to the first of our registered nurses and enrolled nurses in completing these programs.
Certificates provide additional knowledge and skills in specialty areas of practice. Nurses completing a graduate certificate have demonstrated their commitment to excellence in specialty practice. While a graduate certificate enables development of knowledge, skill and critical thinking for specialty practice, a graduate diploma further challenges critical thinking and best practice. We offer our congratulations to all the nurses and midwives who completed postgraduate qualifications in 2022. Congratulations. A master's degree extends a candidate's ability in critical thinking, research, theory and practice. Nurses and midwives with master's qualifications are at the forefront of questioning practice and driving change towards excellence. Congratulations to everyone who completed a master's qualification in 2020. I would also like to acknowledge completion of the Certificate of Health Informatics Australia, the CHAIR course, credentialing program for health informatics. The CHAIR credential demonstrates that candidates meet the health informatics core competency to perform effectively as a health informatics professional in a broad range of practice settings. This concludes the first part of the program, the acknowledgement of certificates, and we will now move on to recognise and announce recipients of awards, scholarships and prizes for 2020. I now invite Marilyn back to the podium to present the Nursing Excellence Award for 2020. Thank you, Marilyn.
Thanks, David. Each month, Bendigo Health presents a Nursing Excellence Award to acknowledge nursing staff for their passion, skill and care, and recognise someone that lives our vision, excellent care, every person, every time. In 2020, we received 70 nominations for the award, and I'd like to congratulate all of those nominees and monthly winners. From the many nominations received across the year, I'm pleased to announce the overall winner of the award for 2020. The recipient received 6 nominations from peers and colleagues, with the overarching theme of these nominations acknowledging his commitment, flexibility, patience and leadership, and his team support. He's described as leading by example with passion, enthusiasm and care for his colleagues and community. The recipient embodies our values of passionate, caring and trustworthy. And I'm pleased to announce the winner of the Nursing Excellence Award for 2020 is Andrew Gale. Congratulations. Come into the camera. Yeah, well done. Congratulations. Thank you. There's your seat. Thank you. Well done. Thank you.
Well done. Okay, I now invite Lynn, a critical care educator, to present the Australian College of Critical Care Nursing Prize. Welcome, Kim.
Thank you, David. The Australian College of Critical Care Nursing Prize celebrates excellence in the graduates of critical care nursing education programs in Victoria. Only one nomination is received from each university course, and from the course promoters and from the clinical educators course. The winner is awarded a one-year membership to the Australian College of Critical Care Nursing and also the opportunity to attend a full study day at the college. The judging framework is based on clinical and academic success, and the person nominated is the nurse in the program who has a sound knowledge of critical care nursing and who you would most happily have care before relatively self-contract. I am pleased to announce that the winner of the 2020 for the La Trobe University Critical Care Stream Award is Molly Kelly. Unfortunately, due to planned leave that was much deserved after the events of last year, Molly is unable to attend the event today. However, she has asked us to convey that she is honoured to receive this award, and I ask Kate Fuller to come up and receive the award on Molly's behalf.
Just like to acknowledge the Australian College of Critical Care Nurses for their support nurses undertaking postgraduate studies. Thank you.
Okay, I now invite Dodie Bischoff, Director of Residential Care, to present the Lynn Gale Award. And Margaret. And Margaret.
Thank you, David. We're proud to be here to represent aged care. Lynn Gale was a nurse educator who coordinated the post-basic certificate in gerontology for many years. This course provided a solid foundation on which the current certificate in gerontology nursing course for registered nurses is built. Lynn's passion was education for nurses, and she worked tirelessly lecturing and consulting with nurses, patients, residents throughout her years. Sadly, Lynn died of lymphoma in 1994. This prize is awarded in commemoration of her commitment and contribution to nursing education. The selection of the recipient of the Lynn Gale Prize involves review of academic achievement, group participant, and the clinical application of knowledge and skills, therefore making a positive difference in the workforce. The recipient of the Lynn Gale Award for 2020 consistently displayed passion for aged care, achieved excellent academic results, and throughout the year demonstrated the Bendigo Health values of caring, passionate and trustworthy. Please join me in congratulating Joanne Irving as the recipient.
See you on the
Thanks, Joanne. Congratulations.
Congratulations, well done.
Thank you so much. Thank you. Thank you so much.
Thank you, Dodie and Margaret. We'll move on now to the Julie McDonald Excellence Award. I now invite Kim back up and Laurie with this time to present the Julie McDonald Award for the Excellence during the Graduate Certificate in Critical Care Nursing at La Trobe University. Welcome back, Kim.
Thank you, David. Julie McDonald was employed as a Bendigo Health clinical educator for the postgraduate critical care nursing course held in collaboration with La Trobe University from 1999 to 2002. Prior to 1999, Julie was employed in the critical care unit at Bendigo Health in the Older Hospital as an associate nurse manager. The educator position that she then subsequently held combined both classroom teaching and bedside clinical education. Julie set a benchmark in quality teaching and genuine collaboration between Bendigo Health and La Trobe University Bendigo. Tragically, Julie and two of her daughters, Kelly and Ruth, died in a car accident in 2002. Julie is greatly missed and remembered very fondly by her colleagues in both ICU and MD. An award in Julie's name is bestowed each year jointly by Bendigo Health and La Trobe University upon a graduate of the postgraduate critical care nursing course. The recipient upholds the objectives to which Julie always strove. Excellence in clinical patient care and academic achievement, and the contribution to the professional development of colleagues. I am very pleased to announce that Tamara Williams is the recipient of the Julie McDonald Excellence Award. Well done.
Okay, Kim, you don't go too far. Now we've got the Intensive Care Auxiliary Scholarship. So once again, I'll invite Kim back to the podium. Thank you, Kim.
Thank you, David. The volunteer members of the Intensive Care Auxiliary devote enormous efforts to raise funds that benefit critically ill patients. This includes raising funds for essential equipment, but it also includes fundraising that enables nurses to undertake the postgraduate study that is required to care for those critically ill patients. The three successful recipients, and I emphasise three, it's an amazing fundraising effort by the auxiliary members. The three successful recipients of the Intensive Care Auxiliary Scholarship received $4,000 each to cover course fees and other expenses. The scholarships are awarded to nurses who demonstrate exemplary commitment to postgraduate studies in critical care. I'm pleased to announce that the recipients for 2020, Claire Slatter, Danielle Howard and Molly Kelly as recipients of the Intensive Care Auxiliary Scholarships for 2020. Unfortunately, all three recipients are unable to attend today, but I'm very pleased that we've got a member of the auxiliary here. Claire is currently rostered on night shift, and both Danielle and Molly are taking that well-deserved leave. Claire has indicated that she is, I quote, very grateful and appreciative to receive this scholarship and noted the wonderful work of the ICU Auxiliary and the contribution made by them to Bendigo Health. Danielle has asked that we convey that she is very grateful to be a recipient of this scholarship and that last year was the most challenging and rewarding year of her career as a nurse at Bendigo Health. And Molly is very honoured to have also received this scholarship. And Kate Fuller will receive on their behalf. First to Kate, okay?
First of all, I'd just like to apologise for our president and our secretary, both of them couldn't attend today, so you stuck with me. I'm the one that signs the checks.
Oh,
well. So, on behalf of our auxiliary, we're very honoured to be able to present three on this occasion. Usually it's just two, which will be this time because last year we couldn't raise any money. And don't forget, people, the third Thursday of every month, have our trading table. So I can present these to you for you to pass on to me. Thank you very much for the support.
Thank you.
Thank you to the auxiliary. Okay, we're up to the Jerry Rutgers Blue Ribbon Foundation Scholarship. So I now invite Sergeant Martin Packworth, President of the Blue Ribbon Foundation Bendigo, to present the Jerry Rutgers Blue Ribbon Foundation Scholarship. I would also like to acknowledge Senior Sergeant Della Nile, Sandy Gaffey from the Victoria Police, and Jerry's sister's not here today. Oh, Jerry's sister's here, yes. Geraldine, who has also joined us today. So, Martin, I'll please ask you to come up. Thank you. So, Mr. Martin.
Victoria Police Blue Ribbon Foundation perpetuates the memory of members of the Victoria Police killed in the line of duty. Through the support of worthwhile community projects throughout Victoria, the Foundation recognises the dangers that police members face on a daily basis. This award is to honour the memory of police officers and to ensure their sacrifices are acknowledged. As the nurses who receive the awards will preserve and save lives, the awarding of these scholarships is a fitting way to commemorate the lives lost. Jerry Hutchins was an Inspector of Police in Bendigo and also President of the Bendigo Blue Ribbon Foundation. Jerry valued family, sports, the outdoors, was a black belt in karate and was also awarded the Warrior Award by his club. Jerry was a great believer in doing the right thing and unfailingly was committed to his job and helping others. He was the proud recipient of the first ever National Police Service Medal in 2012. Sadly, Jerry passed away due to cancer in 2012, and this Blue Ribbon Award has been named in his memory. I'm pleased to announce that the recipient of the Jerry Hutchins Blue Ribbon Scholarship for 2020 is Danielle Vasilevsky.
Thank you. I'd like to just recognise the Jerry Hutchins Blue Ribbon Foundation. I'd like to thank all frontline workers, whether it be police, firemen, emergency workers, everyone, especially in between Bendigo Health in the past year with this pandemic. We've all really stuck together and we've done an amazing job for our Bendigo community. I'd like to thank for the scholarship and everyone who's attended today. Thank you.
Each year, the Department of Health and Human Services make available a limited number of scholarships for nurses and midwives to pursue their postgraduate studies. The allocation of these scholarships is a highly competitive process. Congratulations to the 15 nurses from Bendigo Health who were successful in the 2020-21 year. We'll now move on to the 2020 Graduate of the Year. I now invite Bob Cameron, our Board Chair at Bendigo Health, to present the award for the 2020 Graduate of the Year. Welcome, Bob.
Thank you very much, David, and ladies and gentlemen, nurses and midwives. It's a great pleasure to be here. This award is to recognise the outstanding performance of a graduate nurse or midwife in their first year of clinical practice. And it's based on their professionalism, their clinical skills, and their strong commitment to Bendigo Health's core values and beliefs. And it's been especially difficult in the first year, given the first year that they have had when we've had a pandemic and we've had so much change thrust upon them so early in their careers. And I'd like to acknowledge the nominees for 2020. You've been outstanding. I congratulate each of you. The graduate that was chosen from the 8 nominations is described as exemplifying the motto, excellent care, every person, every time. The recipient is passionate about the nursing profession and a strong patient advocate. She successfully managed complex neurological patients and compassionately cared for the frail and the elderly. The recipient gained the trust and respect of both colleagues and patients and excelled during her graduate year, making the most of every learning opportunity. Please join me in congratulating Bridie Davies as the recipient of 2020 Graduate of the Year. Thank you. All the very best for a great career.
Oh, thank you very much.
Thank you, Bob. Well, we're getting closer and closer to the end of the program. So congratulations to all our nurses and midwives who have been recognised today for their achievements, and we thank them for the significant contributions they make to excellent care for every patient every time. I would now once again like to invite Bob back to the podium to give a closing address before we officially close the ceremony. Welcome, Bob.
Thank you again. And today we've seen some incredible nurses, and to all of them, the recipients, and to To all of those who have been nominated, we congratulate you all. And what we're really seeing is the ever increasing of standards across the nursing profession, not only across the state, but right here at Bendigo Health. So let's all join together to give them all the very best wishes for the future. Both the International Midwives Day and International Nursing Day are always highlights in the Bendigo Health calendar. And the board enjoys seeing the innovative ways that you celebrate each year and the way you showcase nursing at Bendigo Health. And we look forward to your video soon promoting nursing. This year has been a very, very challenging year in the last year. The enormous level of change that's occurred, the enormous level of leadership that's had to be given, and the resilience of nurses in a very, very changing way. You know, everything else that goes with it. You know, all of the PPE. You know, the temperature in, the temperature out, all of the changes that occur. It's a great credit to you as a profession. Bendigo Health is a great family, and hospitals run on nurses, and Bendigo Health runs on nurses. And so can I just say that the board is very proud of you, and that the people of this great city in this region are very proud of its hospital, very proud of its nurses. And so on their behalf, can I say thank you, and please, let's enjoy today's celebration.
So before we have got two videos that we'll share. We'll always have a bit of fun at the end of these meetings, as you know. So we've got actual two videos. One is development from our comms and marketing team in celebrating and showing the growth of nurses and midwives throughout the organisation and the opportunities that our profession has in this wonderful organisation. And also there's another video which is more generalised. So Elise, we might start off with the first video.
For the average person, the demands are too high, the hours too tough, the problems too complex, and the push too intense. Maybe it's because the average person isn't wired the way nurses are. They stand apart with their willingness to make the sacrifice, to embrace their role in the bigger picture. They have the vision to see how each department, each doctor, each technician, and each nurse has to work in seamless harmony. And the ability to see the world through a patient's eyes. To look at a cancer patient who's worn down from chemo and know just the right thing to say to bring her back around. To talk to a child who's going into surgery and assure him everything's going to be all right. To push past the sore feet, the headaches, and the obstacles, and keep performing at a level that seems almost superhuman. Caregiver, problem solver, family counselor, friend. Not many people can do what you do, which leaves us only one more thing to say.
To all the nurses and midwives at Bendigo Health, thank you for providing outstanding care to our consumers. Today is all about celebrating our profession and acknowledging the contributions made by nurses and midwives. Officially closes the ceremony. Thank you for all attending in presence here and also virtually. This is being recorded, so please share it. It's once again a great celebration of our profession, and thank you to you all. Have a great day. Thank you.